Okay, good afternoon, folks. We are back here at House Human Services, and we are picking up testimony from various community partners who our budget teams have recommended spend an opportunity here for 15 minutes and 15 minutes only. And if you are mid-sentence, we are going to be cutting you off because we have a lot of people to hear from. We are welcoming right now the Parent Child Center Network, and we have Ellen and Claire. So welcome.
Thank you so much.
Right, you don't. We won't start timing you until you sit down and introduce yourself.
Stand up for your presentation.
Yeah, we are running a clock just for people to know. Because this could very easily go south if we don't keep track.
Yeah, I can imagine.
And I don't want to be, we're already being accused of giving some people preferential treatment that they get to be here and some don't, but. Okay.
Hey, good afternoon, everybody. Thank you so much for having us here. So I'm going to start out telling you a little bit about our impact and what we've been doing for the past year and a half now that we are a professional network. And then I'm going to turn it over to Claire, who will tell you specifically about our budget ask. Just get rid of this. The Parent-Child Network was actually established way back in 1988, authorized under state statute to provide 8 core services. We'll tell you what those are in a minute. We cover all regions of the state. There are 15 parent-child centers that have been around since the late 80s and early 90s. In fiscal year 23, the legislature passed Act 150, authorizing the network to administer the Parent-Child Center Integrated Grant. So multiple funding sources were put together in the integrated grant. It now comes as of August, when I was hired, it now comes to the network, $7 million and change, and we disperse it to the 15 parent-child centers. That state funding comes through the Department of Children and Families, Child Development Division, and that $7 million is our allocation for the past 2 years now, and we see that that is also in the governor's budget for this year. And the purpose of the network is by deepening our collaboration as a network comprised of leaders from each center, we can really build our statewide standards. We can increase our collective impact and work more closely together in an integrated way to provide consistent services for families with kids under the age 6 all over Vermont. Okay, so our centers are welcoming hubs in the community that are responsive to local needs. This past year, we served over 22,000 parents and 23,000 children. This includes 1,170 kids who have developmental, physical, or health-related needs. Here are our 8 core services. We do have an impact report that's online that we shared with you that has information that specifically about what these are, but you can see them: parent support, parent education, concrete supports, home visits, playgroups, information and referral, early childhood services, and community development. Just a few highlights from the past year. We served more than 22,000 parents this past year. That is an increase of about 3,000 over the previous year. Concrete supports, we're going to be talking to you more about that in our ask, but this past year we provided concrete supports to 4,220 families. That's a 28% rise over the previous year. And if that phrase concrete supports may not be obvious to everyone, but that is like essential items and usually financial, but sometimes also a referral source that helps meet a temporary need that will help increase well-being for a family. You know, things like evictions, helping with utility cutoffs, a few extra diapers for that week, emergency food, clothing, a car repair so that they can get to work, those kinds of things. We also hosted 3,000 playgroups around the state last year, providing opportunities to prevent isolation and strengthening parenting. And we served 1,770 families through Welcome Baby supports. These are supports that go to families with newborns. It could be package a home visit, reaching them. And that is amazingly far-reaching in that we got to 1/3 of all the babies born in Vermont. We do maintain standards. We're part of the National Family Support Network, which is a national organization that maintains standards for family resource centers. That's another word for parent-child centers. We follow the standards of quality for family strengthening. We embed the 5 protective factors into all of our work. That is actually how we measure our impact against those 5 protective factors: parent resilience, social connections, knowledge of parenting and child development, concrete support, and social emotional competence of children. And the research on child development, these are embedded in the research. When we know these protective factors are there for families, the outcomes are better. Lower level of child maltreatment, increased income for parents, health indicators are better on a range of health indicators are improved when these key factors are in place. Okay, this is in our impact report. This is how one of the key ways that we measure our impact. And a couple of things I just want to point out to you. It's a little hard to read on the screen, but the 2 that really stick out to us are, I know where I can get helpful information about parenting and taking care of my children. We go from 65% have that feeling before they use their parent-child center to 98% afterwards. That's quite a big increase. That shows that the parent-child centers are really a place where people feel comfortable going to get a range of services. And I have relationships with people who provide me with support when I need it. 54% before they came into a parent-child center had those relationships. 92% had those kinds of relationships afterwards. So that really shows that we are a source of support for families. Another report that we just got our eyes on was NORC did an evaluation of Vermont's 1115 waiver Medicaid program. And they did a specific deep dive into the parent-child centers, and there's a range of positive outcomes. I won't go into them. They're in your report. So I want to save time for our ask. And I'll turn it over to my colleague Claire to tell you about what we are asking for.
Thanks, Ellen. And thank you so much, committee members, for allowing us the opportunity to testify today about our budget requests. So the Vermont Parent-Child Center Network is requesting an FY27 increase of $1.88 million in the integrated grant to bring us to a total of $8.9 million. The 3 key prongs to this request: concrete supports, which we just described as a core service that goes out the door to families. It goes in and out parent-child centers to families in every community. So a total of that is $180,000, $12,000 per PCC for just what Ellen described earlier in terms of helping families spiral and the safety net shredded, basically keeping it intact and preventing families from falling further into risk. Benefit assisters, which I think this committee may have been hearing about, having benefit assisting across the state of Vermont, every parent-child center for $1.2 million, $80,000 per parent-child center to have staff trained in helping families apply and remain on essential safety net benefits, housing, SNAP, Medicaid, et cetera, to help prevent adverse effects of poverty. And then lastly, increasing capacity and support for staff. That's $500,000 of the 1.8 million, 33,000 per PCC to help us maintain staffing levels, adequate wages, and meeting increased needs for services, which you can tell from Ellen's report. There is a percentage increase across the board for demand for services, and our population numbers are increasing. So concrete supports, it's a core service, just what Ellen had said. We currently get federal funds for this. It is CPCAP, Community-Based Child Abuse Prevention dollars, upwards of 11,000 each. Our request is to double this so we can leverage more funds. Again, this goes out the door to families. It does not stay internally. And it runs out every year, sometimes mid-year. Some years are harder than others, but we expend the funds, all of us, and we have nothing left to give out to families, and the needs increase, especially from here now till summer. Research shows, and I think this is really critical, family experiences of material hardship for children are associated with poor development outcomes and increased rates of child welfare system involvement. So those are predictors that we feel we're able to turn a curve on if we can provide parents with the critical tools and resources they need. Long-term outcomes for children improve. Losing benefit of sisters. Again, this committee is aware of this. We're part of a coalition ask for benefit of sisters across the state of Vermont. Losing Medicaid and SNAP is devastating for families. It is a lose-lose for the state of Vermont in terms of revenue and Medicaid revenue streams that all systems rely on: medical, mental health, et cetera. So the federal safety net programs are critical for families. We're out in community. Parents are already turning to us to provide this service. We're helping currently. I've testified on Thursday in the budget hearings. We're actively helping families. I just gave 3 examples. Homeless family specifically, no address, no ability to get documentation. They lost Medicaid. We were able to help them directly on our portal. We can help get copies of birth certificates, copies of social security cards, vital documents and records that are required. We can scan, we can use our equipment, we can get it all uploaded into Vermont Connect, Health Connect, and then support them as requests are made along the way. It's real and it's vital, and we can absolutely realize benefit for families in our state if we're able to increase the capacity to help people SNAP and Medicaid specifically. For the state of Vermont. And then increased capacity to support staff. PCCs have been level funded since FY24, leaving us without funds to cover salary increases, and health insurance costs have skyrocketed. I don't want to rush. I want to leave time for questions. We're serving.
All right, I'm going to take 3 minutes afterwards for questions. So you get to use your whole 15 minutes.
Okay, fair. Thank you, Chair. Thank you. A base funding increase will help us maintain increased service levels, which we've referenced, and help us with our financial stability and viability. We expect to continue to see year over year increased numbers of families coming to us and requiring additional supports, and we want to be there for them. And we plan to be. Here's just an example of some of the services that we provide that are vital state contracted services: children's integrated services, community child care support agencies, Dulce, family supportive housing, which is case management for families that are currently experiencing homelessness. Many of us are licensed child care providers across the state, and we're one single point of entry for services. Co-location of services is very cost effective, and it improves access. Thank you so much for the time today.
Thank you very much. Awesome. You still have 2 minutes and 33 seconds. Questions from committee members? Yes, go
I
ahead.
apologize if I'm late. Are you asking for more money or what's already in the budget? And you're just explaining to us what you do.
It is not in the governor's recommended budget. Our request is $1.88 million.
Okay, so where would it come from? I guess that would be the question, because
right.
I want to stick with the budget
Yeah.
personally.
All right. This is their opportunity to make their case about whether they think.
Okay, okay.
So that's the way it's working for everyone. Do you have any idea off the top of your head or a percentage, give me a range of how many families that you serve who are homeless?
Currently, do you mean across the state or in Washington County?
No, I mean across the state, yeah.
It's increasingly growing demographic. I know for our Parent Child Center, we have at least, I want to say 75 to 80 families that we're currently serving that are enrolled in FSH. And so that's just Washington County, which we are second to Chittenden in the state for homelessness family population. So I could probably roll that up to probably 200 off the record, and I can look into that and get back to you.
Okay,
And also the PCC play a big role in preventing homelessness and providing the supports for people. So if you pay for new tires for their car, they can get to work and they don't lose their job and they don't spiral into other financial issues. We can also pay a partial rent payment, can't pay rent on an ongoing basis with our $12,000 each in CDCAP funds, but we can help people put packages together so they can.
But I'm
Yeah.
sorry, Ellen, but we'll pool resources often within our region. So HOP grants, Capstone, family centers, concrete assistance, church, community funds, we'll pool them. So families aren't necessarily double dipping. It's not duplication. We'll put together the package ask of what a family needs, whether it is security, back rent. And we'll also work closely, we do with Downstreet in Central Vermont, and we'll help reconcile bad credit histories, bad rental histories, and we'll go to hearings around supporting them and writing references for their rental histories to do some repair and to help keep people safely housed. And we provide case management. And I was listening to that conversation, Representative. Our family supportive housing program is all case management based, and it has strong success rates. I'm sure Deputy Commissioner Sojourner can help provide that information, but there's a report that's statewide that shows the trends in terms of number of families that are exiting the program successfully and stably housed.
thank you. Other questions? Go ahead, Representative Bishop.
Two of the three asks reference how much that would be per parent-child center. The $500,000 doesn't reference an even divide. Is there anything you can share with us about the intention of how that money is spent?
Approximately the same division of 15, so about 33,000. Does
Okay.
that answer your question?
Thank you.
I'm going to ask this of everybody who talks about the assisters, but how do you view this as being different than what your staff are already doing to help families, like the example that you gave?
The example that I gave is driven through foresight, and we had an opportunity through Children's Integrated Services to train some staff statewide, and I encouraged a few of my staff to be proactive and get that training in anticipation of the budget reconciliation bill that the feds passed in October. So it wasn't something we were doing prior to that. It was an intention to be prepared to meet the needs in our community, of which we have. We know there was a timeline that pushed some of those changes out to SNAP specifically, or they're going to be realized soon around work requirements. So a number of those things were pushed out towards the federal year 28. I think a lot of us are doing it proactively to be supportive, and the funding's not there to sustain it, to sustain someone taking a percentage of their time from other work that they're doing to maintain also a volume, an increase in volume to meet need. Does that answer your question, Chair?
It did. Thank you. Anybody else have any final question? Thank you so much. We appreciate you being here and all the work that you do out there. Appreciate it.
Thank you all so much for your time today.
Okay, next up is Jonathan Williams. And I don't remember, Jonathan, if you were here when we talked about a strict 15 minutes. And we'll give you a 5-minute heads up. And then we'll take 3 to 4 minutes afterwards for questions.
Thank you. I've sent a share request to, oh, there you go.
Okay. And I don't know if our next witness is also going to be sharing on the screen. If he is, then he should be getting his ready to go. There you go. Thank you, Jonathan.
Thank you, committee members. It's so nice to see you. My name is Jonathan Williams. I'm the Executive Director of Prevent Child Abuse Vermont. It is my 8th month on the job. Prevent Child Abuse Vermont is celebrating its 50th anniversary this year, which I think is notable. Prevent Child Abuse serves the entire state of Vermont in all 14 counties in Vermont. Collectively, we serve more than 11,000 individuals, adults and children, and indirectly impact an additional 86,000 children. We have 4 key programs, but I don't want to get bogged down in the alphabet soup, so I'm just going to tell you what they do. Our family support programs provide supports for parents who are learning to be better caregivers for their children. It operates in corrections facilities, hospitals, parent-child centers, daycare facilities, and community centers across the state of Vermont. We offer our Inside Out Dads program, which supports fathers, incarcerated fathers, learn to be better parents. We provide supports for parents impacted by substance use disorder, and we provide Circle of Parents, which is facilitated peer-led gatherings of parents and caregivers. Our Healthy Relationships Project is our school-based prevention curricula. It's data-informed and also informed by persons with lived experience. It is age-appropriate, so you are not providing the same lessons to adolescents as you would be to young children. We have our Safe Environments for Infants and Toddlers program, that's Shaken Baby Syndrome and safe sleep training in schools. And then we also published the Vermont Parents Home Companion, which has been published for more than 35 years. That is a resource that is given to all new parents in Vermont, offered to all new parents in Vermont. We have 10 employees. We have a $1.1 million budget. We used to have 12 employees. Unfortunately, due to delays in federal grant funding, we had to restructure in the fall of this year, as well as diminish philanthropic support. Here's some key statistics on why prevention works. We have partnered with Florida International University and Johns Hopkins. It shows that for every 2 additional adult prevention trainings, that correlates to one decrease of 1 substantiated case of abuse in Vermont. That is published research. We also have data that shows that detailing the costs of child sexual abuse in Vermont, it is unfortunately distasteful to have to quantify these incidents, which create very real harm for people. Here's additional data, but the one key statistic I want to share, and we can back this up with math, and I am happy to provide it to you. It's in our slides and in the comments. Preventing 100 incidents a year saves the state of Vermont $500,000, $500,000. And we can back that up with actual figures. In Vermont, since 1992, there has been a 72% decrease in victims of substantiated abuse cases and a 76% reduction in children who sexually harm other children since 1990. That correlates very strongly with the length of time that PCAVT has been funded. Funding PCAVT and these types of programs works. I want to highlight that we receive a tremendous number of referrals from the Department for Children and Families, and that trend has been increasing over the years. They are referrals to our family support programs. We also receive referrals from the courts, from schools, high school and middle schools, as well as the parent-child centers. Our records go back as far as 2012. Unfortunately, records prior to that time were destroyed in the flooding in 2023, which is personally very ironic for me. Our funding has not increased since 2012, base appropriation funding. Our records indicate what records we do have we have received an appropriation since the mid-90s. The proposed funding cut in the governor's budget is a 50% cut across all of our programs. Does not correlate to not meeting our grant requirements. It does not correlate to other service providers being able to provide similar programming due to a duplication of services. It is a 50% cut across all 3 very different programs. This is that trend I showed that indicates that substantiated CSA victims have decreased by 72% since 1992. Again, that correlates very strongly with Prevent Child Abuse Vermont receiving funding. Here's another way to view our proposed cut. Here's some information that I won't go over that details who else does this work nationally. But in truth, no one provides this programming locally in the state of Vermont, and no one provides live training with the ability to answer questions as they arise. Here's some additional information. I think I opened the lengthier slide deck. My apologies. I already screwed up.
It's in a different order than what we
In a different order. I'm sorry. So this is way more information than you need in 15 minutes, but roughly, if the cuts come to pass, that is 1/5 of our budget. It correlates to a 20% funding cut that typically a very common estimate is that it correlates to 25 to 30%, 35% reduction in program capacity. That means 2,308 fewer Vermont adults and 1,035 fewer children in Vermont served. That's what these cuts will mean. Some additional stories of impact. I will share the lengthier slide deck afterwards. Participant quotes. Prevent Child Abuse Vermont has been in this committee, I know, many times before. They do good work. We are providing pennies on the dollar services to thousands, tens of thousands of Vermonters. It is a cost savings to Vermont to provide $403,000 in a base appropriation funding. I know there was one-time funding that was during the COVID pandemic. But truly, this work is saving the state of Vermont money. We have indicated if I can find it here. Nope, it's not in this slide. Wonderful. In your handouts, I have indicated some areas that I think could be used to fund this work.
Yes, you did.
I have an immense appreciation for the need for housing for the unhoused. However, I do, having worked on that issue in Berry City, and I realize its impact and the absolute necessity of it. However, I do wonder how many of those projects will be shovel ready by fiscal year 2027, which is July 1. And I wonder if a small portion, I think it's 0.4 or 0.6% of that funding could be used to fund our base appropriation, which again has not increased since as far back as our records go. There is the possibility of funding us through the rainy day fund potentially. And there is also the possibility of using funding from the governor's surplus. And it wouldn't be used to only a portion, 0.4, 0.6%. I can't recall off the top of my head which one it is, but it's less than 1% of that funding could be used to support our programming, as well as restore the cuts to our partners, Lund and Easterworks, who are also providing essential services to Vermonters in this work, in this sector. So I'm happy to answer any questions. Thank you sincerely for your time. I know it is not easy what you do, and your decisions have very real impacts on people. As you may know, I was a legislator, but I served in commerce, and they have it way easier over there. So,
You know, I think by the end of this session, we're all going to be asking for a change of venue. Let me tell you.
really appreciate that. Again, my apologies. I provided why is it in? Oh, okay. Thank you. Oh, no, you're good.
Thank you. Let's go for questions.
If you have any questions.
I have a quick question for you. One of the things that I'm a little bit familiar with is the extent to which data backs up your the work that you do. And independent data. So one of the things that we talked a little bit more about in this committee is having essentially verification of outcomes and data that supports it. And so could you just speak a little bit more about the sort of independent verification of the work that you do?
Absolutely. Well, there was that study that I cited that was a published study, so it is independently reviewed and verified. And it does indicate that it was a study conducted in Vermont, and it indicates that providing 2 of our Healthy Relationships program classes in a single county in Vermont results in 1 substantiated case of sexual abuse being prevented. So again, I will, you can't prove that something did not happen, but I will refer you to that, the data that I mentioned previously, which is preventing 10 cases of abuse saves the state of Vermont amortized across the lifetime of that individual, across those individuals, $500,000. So if we are, and we are providing trainings to tens of thousands of Vermonters. So if just 100 of those 11,000 individuals that we serve, if that data points to those incidents of sexual abuse being prevented, then we will have already made up the cut that that the administration is proposing. And I'm quite certain that we, through these trainings, through the surveys, the results-based accountability surveys that we issue and collect every year, that we are preventing far more cases of that. There's also studies that are, again, are in the handouts, studies from the University of Georgia highlighting the cost of child sexual abuse in the United States. As well, there's CDC data around the cost of the lifetime cost of rape. There is data from Vermont Network Against Domestic and Sexual Violence, which indicates that the public cost of domestic and sexual violence in Vermont is $111 million per year for the state of Vermont. So again, prevention works. It really, I know it is hard to prove an incident did not occur, but it is far more impactful in this sector and in food security and in housing and supporting the unhoused. Prevention saves the state of Vermont money. Again and again, we have learned that so many times.
Thank you.
Certainly.
Any other questions? Any members? No. Go ahead, Representative Bishop. You'll have the final question.
You referenced moving 12 staff members to 10, and that was driven, it sounded like, primarily by two things. One, a delay in federal funds, and the second, some curtailing, if you will, or bringing in less in philanthropic dollars than anticipated. Is there anything you can tell us in the months or time since then, what the federal picture looks like for you for funding? And sure, I don't know if that was a specific grant that was lost from the philanthropic side.
It was a pass-through federal grant to the state of Vermont to us. It was the funding delays were very much exacerbated by the government shutdown in the last fall. I will share that there are a number of state and federal grants that are not as timely as we would like them to be, mostly because they are reimbursement grants. And so we have to expend those monies in order to then draw them down. This grant, which is proposed being cut in half, is a general fund dollar grant that is appropriated through the Department for Children and Families. And again, a reimbursement grant. So we have to spend the money in order to be reimbursed. And as a result of that, we do not have a lot of cash on hand due to the economic climate. And so we are having to borrow on our line of credit, which we have to pay down. We have done our best to diversify our funding streams. I come to this work from the Vermont Food Bank and have done my very best to improve our fundraising best practices in order to be less reliant on state and federal dollars. However, and we have turned a corner, I strongly believe, but this does pull the rug out from us a little bit, this proposed cut.
Thank you very much.
Thank you.
Thank you, Jonathan. Okay, next up is going to be Matthew Bernstein. Welcome.
Hello, everyone. Good afternoon. My name is Matthew Bernstein. I am the Child, Youth, and Family Advocate for the state of Vermont. Before I start, I just wanted to say we have a 2-page, and I have not, apologies to Lori. I was on such good track, Madam Chair, last time by submitting my materials in advance, but we also have some pretty major capacity issues and a lot going on. So anyway, I will submit my materials after this. And there's 2 things. There's the slideshow and there's a handout. At the end of the slideshow, there's a citation to this document I'm referring to, and also in the handout is the actual 2-page document. And what it is a front and back from Chapin Hall with the kind of more, probably some of the same studies that Jonathan mentioned about return on investment for prevention programs and the cost. One side, I believe, is the cost of maltreatment. The other side is return on investment for prevention. So I just wanted to mention that. I also wanted to confess that while I will, oops, I better start my stopwatch. While I will finish in 15 minutes.
Yes.
No, well, this is the official time.
Nice.
Well, I will finish in 15 minutes. This is definitely not a 15-minute presentation, which is just as it ought to be. Whoops, sorry, that's some funny animation. So here's where we're going. This is just the agenda. Here is our mandate. And many of you have seen these before. I want to emphasize we're independent, we're nonpartisan. I want to emphasize that child welfare is incredibly bipartisan, tripartisan. This is not, none of this breaks down along party lines, which I think is great. Our job is to provide systemic information to many players, especially you all, or including you all, including the governor, including state agencies. We made, this last bullet is in our confidentiality section, but I think it just helps get to our mission. We may publicly disclose any patterns of conduct or repeated incidents if likely to mitigate a risk posed to the health, safety, and welfare of a child or youth. And maybe I'll go backwards on this slide. So the last bullet there is another piece of our mandate that I think is important. The office shall advocate for the welfare of children and youths receiving services from the department directly or through funds provided by the department and those involved in the child protection and juvenile justice system. So that's kind of, that's in the 3202 is kind of like the core of our mission. You all, probably wrote this. You know this, but I think it's, I look at this statute, I've looked at it 1,000 times and, once a day, whether I need it or not, because it helps me focus on what our job is. And I think to get to the other bullets on this page, I think it's unusual for a state agency to be up here testifying about a different state agency's budget, right? But this slide gets to why we're doing that. We do not also, as the second bullet says, oversee DCF. We work collaboratively with DCF. We are independent. We advocate for children and youth in those systems. But this is a topic on which I feel we really have to speak out. And, it's much broader than I think what's on the agenda today. Budgets are moral documents. You probably heard this before. Crisis is not policy. So what this means is when I am in meetings and they're about DCF's deep end systems, they're locked systems, acute facilities, inpatient facilities, and I say we need to invest in prevention. The response I get is that's not what this meeting is about. You see what's on the agenda. This is the high-end system of care committee. This is the whatever it is. And then I started to ask, where is that meeting where I can say that thing? And I'm truthfully shocked that the answer is sort of just staring blank, honestly. Crisis is not policy. The way I see DCF is I see DCF's policy as in, and its crises are melded together right now. And what I mean is because there are children who need placements today, because there are not enough foster homes, because there are, some folks would say there are not enough locked facilities. I strongly disagree with that. I would say because there are not enough step-down facilities, there are not enough rungs in our ladder in our system of care. That drives almost everything DCF is doing in terms of policy. And what I mean by policy in this sense is building programs or not building programs. Where are they investing their money? What are they trying to create? And right now, almost everything that I see DCF's trying to create is in the deepest end of the system. And that is hugely problematic. So to summarize this, and I may get through 3 slides here. So to summarize the testimony, these cuts, especially those 2 that you just heard about and the previous witness, are a catastrophic mistake. I really don't like to be dramatic, truly. And the collaborative piece is crucial. And, and as you know, I focus on systems, not people, but this is a massive mistake. And it's emotional because it's such a mistake. They are decent. The proposed cuts that you see to Prevent Child Abuse Vermont, but also there's a couple of others on the next slide. I cannot, I'm almost apoplectic with how much in the wrong direction we are headed with this. Especially because, we're talking about return on investment. We're talking about data, as we should be, with Prevent Child Abuse Vermont and others, the parent-child centers, and our office too. We do this. And I don't see this at all for the deep end systems. I don't see this at all for West River Haven. I don't see this for Red Clover. I don't see this for Green Mountain Youth Campus. I don't see any data. I don't see any data, truly. And those are, 10 times more expensive than what we're talking about cutting from Jonathan's programs. So I think as the 4th bullet says, and I will try to breathe. The 4th bullet says, downward budgetary pressures should be on acute and locked settings, not on prevention. And what that means is it should be It should be our deep end systems, no matter who's running them, that should have to, where we as a legislature, we as a government are saying, that's all you get. You got to figure it out. And why? Because we should not want kids to end up in those systems, right? We should not want to build out those systems because, we all know that the systemic gravity of those systems, especially when not only are there not prevention systems being built out, but they're actually being actively cut, that just pushes the whole system towards the deeper end and it makes things worse and not better. So it seems like a double standard to me that we are making these amazing community providers come in and justify their work. I mean, I think that in and of itself is important. We are handing out no bid contracts to for-profit prison corporations that are, at an incredibly high amount. And I don't see these same questions to them. And I'm not talking about you guys. I just think in general, there is not accountability for those systems. So I meant to bring our annual report and I forgot to, but it is linked in the notes. I meant to bring the actual physical copies for party favors. This chart is in our annual report. I was honestly surprised to find this. I really just was like poking around on this nationwide child trends report, and they didn't have the states lined up against each other, but they had all the tables and they were sorted alphabetically. So I just sorted them by who's spending the most or the least. And it honestly surprised me that Vermont spends, these are state dollars, I should say, which is what we're talking about. 2% of its child welfare budget on preventive services, 1% on child protective services, the second lowest state of any reported. There was like 40 something reported. But as you see, we're the third highest in out-of-home placements. That would be foster care and on down the line. We're about average in adoption and guardianship, and we're second highest for older youth. That's largely because we're not participating in a federal reimbursement program for older youth. So essentially our spending is upside down. And, again, unfortunately, these cuts are only going to make the problem worse. And these are three cuts these are three of the most major prevention cuts that I saw in the DCF budget. There may well be others, or there definitely are others. I mean, there's the aftercare for FFPSA, which is over $1 million, and some other things. I want to emphasize that, the rationale in the budget narrative for cutting this FFPSA prevention services cut, and if you don't know what FFPSA is, it's really not for 15 minutes. But essentially, this is a federal program that reimburses states for prevention. This is, the very, very basic summary. The law in general for all states does have some administrative hurdles. It hasn't been implemented in the best way. But I think it's kind of ironic for DCF to be saying, well, we can't implement this program, i.e. draw down federal dollars, so we're just going to wipe out the 528,000, right? Locked facilities are 100% ineligible for federal funds, right? From the jump. That's, that is one of the first things that juvenile justice, that leaps out when you look at locked facilities. So I don't think that's a justification for cutting the 528,000. I think even if we're not drawing down federal funds, or I know because there's that 2-page handout that I showed you all, I know that those are valuable even if we're drawing down $0 federal dollars in reimbursement. And I think also, building them and expanding them, one day when we have this magic new data system, sorry, that's sarcastic. One day when we have a new data system, we may be able to draw down those dollars.
5-minute warning.
Perfect. So, and then the last statistic hopefully should make you say, what do you mean? Vermont will spend more than $1.6 million this year on each locked bed this is for youth, for juveniles. Right now, Red Clover Treatment Facility Center, which you've probably heard about. That's a lot of money. It might be number one in the nation. There's more data about that in our annual report. Okay, so this is something that, again, is uncomfortable because, we're not in the business of recommending specific programs or saying specific programs are bad or, saying, there's a business that DCF should contract with or shouldn't contract with. However, this is really problematic. DCF just signed this contract. This was in I'm trying to move my Zoom window out of the way. DCF was signed this contract with this company called
He doesn't want to stay, sorry, it keeps flipping back.
Oh, I know why.
No, this is the slide I want.
Oh,
I was just trying to move out. I was trying to move, I see the Zoom window on my screen, which is in the way. The bottom line is, DCF signed this contract with Abraxas to run West River Haven on December 16th, 2025. A month earlier, the same company for, not the same facility, our facility is not up and running yet. They had their license revoked by the state of Pennsylvania. And the specific charges are really important here because, you can throw around words like gross incompetence, et cetera, but the failure to report piece of this is really crucial. The failure to allow access to investigators to the facility. They also, and these documents are in the handout, they got a warning. Let me back up. The initial issue, well, one of the initial issues was a staff member being aggressive with a youth, putting hands on the youth, slamming the youth's neck into a table. The facility did not report that. Then the Pennsylvania regulators said, you were obligated to report that. You need to take some remedial measures. They did not take those remedial measures, which resulted in license revocation. There is also a separate lawsuit alleging systemic sexual abuse at this facility. And none of this is to say that the people running the facility in Vermont are bad, or it's not going to, kids are going to be abused here. Really, our request is incredibly basic. It's the last bullet. How is DCF responding to this? Who provides accountability? How do these allegations impact budget decisions? Because that's what we're talking about today. And how do we know children will be safe at West River Haven? Because I hope you know, we cannot do that. Lauren and I are two-person office. We cannot do that. And in DCF's documents, they say, well, our new lock system is going to be safer than Woodside because we're not running it. But the problem is with this, I've heard privately that top DCF folks have reassured some of you in the room, some legislators, that this is no big deal. Maybe it isn't, maybe it is, but I think maybe some questions are appropriate. But B, they are the ones investigating, right? The folks overseeing this entity is DCF. And we already had this with Woodside, where DCF's regulators wrote reports and it didn't do anything. So again, we're talking about a budget today, but these questions have to be asked. And so I see I'm pretty much out of time. These are some additional questions, and then I have some sources at the end. So there's a statement on page 112. It says, of the DCF budget document, it says, even with the elimination of these funds, someone read this for me. DCF is still looking to expand evidence-based prevention services. And my question is, where, how? I don't see that at all. I see the opposite. And maybe I'm missing something. I'm happy to be missing something. I would be very pleased if DCF came in here and said, Matthew, you were missing our whole menu of prevention that we have planned. But I have not seen it anywhere. Again, that meeting that I keep asking for, I don't know where it is. Has DCF assessed the return on investment of the prevention programs? We talked about that. And then the second one, assess the return on investment of the acute programs and the services. And acute here means locked and staff secure, which is like time delay locks. Number 4 is also crucial. There is virtually no data about Green Mountain Youth Campus, why it's 15 beds, how much it's going to cost, broken down into categories. There's all of this stuff about temporary funding or carryover and one time, and there's a chart that I included in the materials that I'll.
We know all of that, Matthew. So I don't want you to.
I'm not sure you, Chair, respectfully, sorry. I'm not sure you.
We know. No.
You know it's not clear.
No.
Okay.
You need to listen.
I will listen.
Okay. We know that we have not received adequate information about that because we continue to ask those same questions around the locked facilities, the Green Mountain campus. How much is how much carry forward funds? How much we have one of our best people on that. And despite even that, we are, I don't know how to exactly say it, but they have failed to provide comprehensive information that we have asked for. So I want to make sure, I appreciate, we're at the point now where we get to ask you questions.
Fabulous.
So I'll open it up for questions. Go ahead, Representative McGill.
Yeah, I'm wondering if you could tell us, I've been very concerned about this contract. what the current process is. Like, let's say there's a youth at Red Clover that feels they've been experiencing mistreatment. What is the current process if the youth wanted that to report that or for that to be investigated?
That's a good
And then
question.
a
Thank you.
follow-up is, do you have improvements? Or could you provide us improvements for
Mhm.
how we can build more accountability and tighter systems?
Yeah, thank you. So I suppose there are multiple avenues. They could call our office, they could speak with their attorney or their guardian ad litem to, push their conditions through the courts. There is an internal AHS contact. It tends to loop kind of back to DCF. So, that has been successful for some folks in the past. It's not independent. I'm sure I'm missing something. I mean, they could call Disability Rights Vermont, for example, if they had a disability who has access to facilities in a similar but different way that we do, and they could sort of investigate. Those, I think, are the basic ways. Probably, they could call the Attorney General's office in theory or something like that. But, yeah, go ahead. And yeah.
Can I ask, how is, I'm just thinking of when we went and did our tour, and this is one of the things I don't remember asking about. How restricted, could I, if I was a youth at, Red Clover and I felt, could I just go and make a phone call when I asked, or does it depend on my treatment plan or,
I think that would be a good question for DCF and for particularly the Red Clover folks. Usually, what you said, I think, is getting close. You can't just, I don't imagine they allow you to make a call at any time for any reason. However, it's not a one phone call type of situation, to my knowledge. I think a lot of youth are relieved to get to Red Clover from other places, I think, because it's generally, they have access to phone calls, but I don't know the specifics. You asked the second part of the question, though, in terms of improvements, to that system.
Yeah.
I don't want to shy away from saying, with more capacity, our office could regularly visit. We don't have regulatory power, but we do have access to facilities, which is important, and information. Even with an increase in our budget, we could hire a contractor or something. I think what we really need is employees in the base budget. I think improving the legal system would also help with that. In other words, attorneys having smaller caseloads, more time, multidisciplinary representation, which would include a social worker and a peer advocate. I think those are some of the ideas. But I would say there's not a lot currently of oversight in that. Oversight's the wrong word. There's not a lot of access for youth in that situation beyond those people I mentioned. And I think really it's their attorney or us, kind of.
Thank you. Other question? Any other questions? Thank you.
Thank you.
Thank you. I'll submit these documents.
Okay.
I appreciate your time.
Thank you very much. Okay, folks, we are going to hear from another whole host of folks tomorrow. Starting right at 9 o'clock. So, please do be on time tomorrow, because we'll get through a bunch of these tomorrow. And I do want to check in, have people send any proposed language that they have to Katie?
Will be this afternoon.
Okay.
So all the people that are coming now want more money than what's in the budget? Is that what we're doing now?
Not necessarily
Okay.
more.
Okay,
I think,
because I want to stay with so I'm just checking.
yeah, well, I mean, we will, on Friday, when we start to review recommendations from individual teams, people will recall, I said, if you're gonna suggest
Right.
restoring
Find it
something,
somewhere else.
you gotta find it someplace
Okay.
else.
I love that method.
And so, I know people have been.
Like we do at home.
People have been busy looking at that. I think that, what we just heard from this witness was, perhaps we should have more balance in the system in terms of prevention than locked facilities or staff secure facilities, either and both of those.
So just as, the last two folks who testified were on our request.
And
they
you
both
said
have-
you had already worked on finding it somewhere else.
Well, and in both those cases, they were not asking for more money. They were asking for don't cut.
Don't cut.
And so we worked to find alternative sources of funding for them, but so a lot of the witnesses will be like the ones that we heard
Okay,
who were asking that just now.
but the money would have to be found somewhere else in the budget, like we would at home with our own budgets. You don't have Peter, you don't route Paul, and with money, we don't want to burden the taxpayer. Okay, that's what I was hoping I would hear.
So, in looking at, what we heard today, from the Parent Child's Network, from Prevent Child Abuse Vermont, from the Office of Child, Youth and Family Advocate, a lot of those things would be considered preventative services. And, how would we go about that? So we are going to hear from other folks about this concept of benefit assisters. I think that's what they're called. Assisters, I know, I can't remember if it benefits in front of it or not, but I finally got assisters down. So that's a concept I'm asking people to think about how it's a significant investment. But it's an investment that saves resources. So how would we figure out how to fund, some portion of that? I don't think we'll be able to fund all of it, to be honest with you, but and where would be the places? Because it's going to be in multiple budgets or multiple requests. We're going to hear from the community action agencies about it. We just heard from parent child centers, and I'm not sure who else will be mentioning it. Yeah.
Yeah, I just thought, my understanding was that the Community Action Agency representative was kind of gonna give a holistic, their testimony was gonna kind of reference all the different partners that are included in that. So
Yeah.
it would be more encompassing of the whole
Of the whole.
ask.
Yeah.
The community partner, it's actually, is going to talk about the Vermont, or the VCAP is going to do that. Amy Schellenberger is just going to testify just about the benefits sisters.
Right.
So it'll be separate. Yeah.
Those sisters does what?
Benefit assisters, essentially helping people to understand. So there's been lots of changes at the federal level. So federal HR1 bill that was passed. There were lots of changes. So like work reporting requirements or volunteering, or that you have to reapply every 6 months instead of once a year. Most people, the general public, doesn't really understand that. So if you're a person receiving reach up services, you might not understand that you're going to lose your SNAP benefit because you didn't fill out the right paperwork, or you didn't even know that you had to fill out a paperwork that says these are the places I've looked for work, or I have an exemption because I have a young child at home. So people who have young children at home they have certain exemptions, but you might not even know that. So you have to file for those things. It's a big paperwork thing is really what it is, to be perfectly honest. And but it's what the federal government has done to us at this point in time. And so there are thousands of people across the state that don't understand that. And so these assisters, and we'll hear more about them tomorrow, but these assisters are people in the community to help them understand what their requirements are.
I volunteer for everything, so I'm not used to, okay.
You could do it.
Yeah.
Yeah.
I volunteer a lot.
Yeah.
This would be like a great volunteer thing. Awesome to help people that don't understand, and
Yeah.
it'd be a great volunteer program.
So, anyway, so that's what the proposal is before us.
So I help people all the time with paperwork. I type letters for people that are losing their jobs. All free. I won't take anybody's money. I do it all the time. People call me all the time.
Okay, so, for the next, 45 minutes or so, I know that people are sort of getting to the point where they're sort of coalescing around what their recommendations are gonna be. And, just making sure that you're working on your language if you haven't submitted it to Katie already. And that, you're ready for Friday, which is to give us an update and some preliminary recommendations. It doesn't have to be your final, but this is where you think you're headed. So that we're gonna do that on Friday, so that we are able to, really hone in on that by next Tuesday, okay? So we'll be getting our memo to appropriations a little bit late, but it'll be there.
The
harvest budget.
Yeah.
I mean.
Thank you for acknowledging that.
We do have the hardest budgets and they're particularly more hard this year. Yeah, they're really hard this year. Well, Tip is here. I have no idea what we're gonna say about the housing proposal, in the DCF budget. Because we definitely will not have gotten through the work on that. So it's kind of gonna be one of those things that come afterwards.
Right. I think, well, that's been my expectation and, I'll be sure to talk with Bob about it.
But we have a commitment to, I had said outright that we would not be recommending anything more than what the governor has in the budget. So in terms of total dollar amounts, you know, what's in the box. Okay, anybody have any questions about what's expected of them for Friday? Okay,
I got the pro, so I'm not worried.
all right. Go forth and continue your work.